Hey, thanks everyone for joining us here on Fraud in America. I am Jackie DeMar, and I am joined by Jamie Thompson. She was one of our whistleblowers in a recent Acadia Healthcare, well, same exact case. This case involved one of the largest for-profit psychiatric hospitals in the country, who paid nearly $20 million to settle claims against them that they unnecessarily admitted patients and also held patients longer than necessary, among many other things that we will hear about soon. We are also joined by one of her lawyers, Ida Gunasekera, who will talk to us about some of the legal implications involved in the case. So thank you both for joining us today.
You're welcome.
All
Thank you
right.
for having us, Jackie. We're happy to get the word out about these important issues.
Yeah. I mean, in this case, like many of these cases, involves some pretty egregious harm, not just to the taxpayers, but to patients. And so I'm really interested to talk to you all about those things and also about kind of what Jamie went through trying to get that conduct stopped there and also what she's kind of been through since then. So, Jamie, do you want to kind of get us started talking about just a little bit about, before we kind of get into the case, what your background is and kind of your childhood growing up and how you kind of got to where you got to as the director of nursing there at Lakeview.
Sure. So I grew up in Atlanta, Georgia, and oldest of four kids. Always thought I wanted to be a doctor. My grandfather was a surgeon, and my father was an attorney growing up. Mom was a stay-at-home mom. But, growing up, I always thought I was going to be a doctor. So uh, I was fortunate enough to get into Vanderbilt University in Nashville, and I went there for 4 years and majored in biology. My second semester junior year, after taking most of the pre-med classes, I decided I didn't think it was something I wanted to do. Um, and so I actually moved to New York and, for different situations, I was only going to be there for a couple of years, but I decided to go to nursing school then, more because I kind of wanted to be in New York and I didn't know what else I was going to do. So I went to Fairleigh Dickinson in New Jersey and got a bachelor's of science degree in nursing. I got married kind of young, 24, I think, and I had three kids in my 30s. And I was a stay-at-home mom until I got divorced. And after I got divorced, I needed to go back to work. And my first job after the divorce was I went to work for a different behavioral health facility. I was there for 10 years and really kind of worked in many kind of ways. So I worked in assessments, taking doctor's orders and kind of deciding whether a patient was appropriate for our care. I was the charge nurse of the adult male unit for several years. And then I became the manager of our substance abuse and our child and adolescent units. Then I decided I thought maybe I wanted to make a little more money. So I went to law school and graduated from law school. I was a single mom at that time. I worked nights in the hospital, being a nursing supervisor, where I was the only person that everybody in the hospital would go to for any problems, difficulty with admissions, trying to decide whether someone would be admitted, you know, running codes, things like that. And I say all of this really because I learned so much there about how to do it right. You know, behavioral health facilities have come a long way over the years. They're still not even close to being, perfect. But this facility, everybody makes mistakes. That's the difference between, say fraud and malpractice. A mistake, sometimes, you get sued for malpractice for that, but with fraud, it's intentional. And so when there would be a mistake, we would always gather together under our director of nursing and go through and make the changes to improve things. After I decided at the time, then when I graduated from law school, I'd met my husband and decided I didn't want to have to try and solve people's problems, and I didn't want to work 80 hours a week. So, and I was making great money at this hospital where I was working, and had a lot of respect too. Um, so I decided I would stay at that hospital. I then got a notification from a former doc at this facility where I was. He was becoming the director of um, medicine at the hospital, and he enticed me to come. It was a great, you know, great package deal, and I was told that the hospital was, quote unquote, a mess, that they'd had a lot of problems. They'd gone through lots of different directors of nursing. Um, but I thought, well, this is a step in the right direction for me. And my previous employer offered me a lot of money to stay. And I just chose to go elsewhere. So I became the director of nursing. Um, Honestly, I'd never been a director of nursing, a director, and I, I certainly was very green as far as what all needed to be done to be a director of nursing. But I certainly knew how a hospital is run, and you know the different policies and procedures that would be in place. Now, the first thing when I got to Lakeview was there were no policies and procedures. They had used another hospital, their policies and procedures to get the hospital open. And it, from the very beginning, the procedures and the having no policies and no procedures, I mean, it was really kind of an insidious issue from the ground up. Our CEO was I think she was 29, and she had worked in assessments and had a social work degree, no business degree, no, advanced degree. And that's kind of how I got to, where I was.
Just to chime in, this was intentional by Acadia to hire Jamie, who had not been a director of nursing before, but she already had tons of familiarity with the way in which a behavioral health hospital is supposed to be run. And only after she was hired and basically locked in did she realize that she was the sixth director of nursing in 3 months, which is extraordinary when you think about that. So a new person pretty much every 2 weeks, and there were no policies and procedures. And so what they had done was borrowed from another hospital, but they had nothing for their boots on the ground, their nurses and their staff, who were supposed to be providing this really important service for people who were extremely vulnerable. And so once alarm bells started going off, Jamie immediately raised her hand and started to ask questions. And they realized, I think the administration, the Acadia management, realized that this was a problem. They had hired somebody who maybe knew a little too much and was unwilling to just walk away without asking questions and trying to correct the situation for these really vulnerable patients who needed important behavioral health services.
Right. And even when, we're told something's kind of a mess going into it, you don't really know what it's like until you get in there. And even then you're like, well, I can fix this, right? But you can't
Right.
really
And
fix anything, right?
I was told that the difference was that this time I was going to have a lot of support, a lot of support. I'd have freedom in who I could hire. And, part of me had no idea what they kept saying, what kind of support do I need? But I was told that things would be different this time.
And let's talk about that a little bit. So one of the things that was grossly inadequate there was the staffing. So not just the nursing staffing, but the doctor to patient ratios and things like that. So can you talk us through kind of what that looked like? You got there and you realized, oh my God, there's 80 patients to one doctor essentially. Or can you kind of talk us through what the staffing looked like to the patients that were in that patient population?
Sure. So the doctor situation, the doctors, they didn't really have doctors on call. So you for admissions, so say at my old hospital, I would receive a call from a hospital and do a peer-to-peer on a patient, determine whether they were appropriate for our care. And then, 1 a.m., 3 a.m., all night long, I would call our doctor on call because you have to get admission orders. You have to explain to the doctor what the reasons are for him being admitted, what illnesses they had, do they need this, they need that, and then the doctor would, just like any other orders in medicine, a nurse can take doctor's orders and act on them, but it has to be a doctor's order. Now, these doctors wouldn't answer the phone in the middle of the night. So I would come in the morning and patients had been admitted and I'm saying, this is illegal. What is happening here is illegal. But even so, I think my situation is different than the other relator in my in our case, in that he had a lot of people behind him also saying this is crazy. I honestly was the only person in the hospital saying anything was wrong with what was going on. And so I'd be trying to convince these nurses and the people in assessments that you cannot admit this patient. You cannot bring them into a locked facility and, you know, restrict their freedom. It's America, without a doctor's order, without medical necessity. That was my biggest concern, obviously. Um, they, the doctors just, had multiple hospitals they were seeing patients at, and it was an easy salary for them, honestly, because they just were not held to any responsibility, and they would just not show up to the doctor's meetings, to our rounds meetings, um, things like that.
And then once they were in, Jamie, right? Once you had these patients in a locked facility, there was no one actually performing any medical services for them, period.
Right.
And
Right.
worse, they weren't getting the drugs that they needed. Instead, they were getting drugs to keep them controlled and otherwise like not cause issues when the patient, to get to your question, Jackie, about patient to staff ratios, they were having one staff person be responsible for anywhere between 20 to 25 patients. I mean, when you think about that, and these are patients who have serious, significant behavioral health issues, who may be cohabitating with other patients. I mean, that would be impossible for any one staff person, but even worse, to, kind of add insult to injury, those staff people weren't even properly trained. And so they
Right.
didn't know how to handle the situation, but for over medicating some of these patients or not medicating them at all. And so it was like compounded failures that Jamie was seeing from day one, that she kept saying, this is wrong. You're taking advantage of these people. You're making them worse. And then you're discharging them without any kind of planning or treatment right back onto the street, such that, they're a risk to themselves and risk to others.
Right. And so can we just take a little bit of a step back and say, like, what kinds of patients are usually being admitted into these facilities?
Okay, so they children, they would take very young children who had no business being in a behavioral health facility because you can't diagnose bipolar in a 5-year-old. They had children that would be like 5, all the way up to very old and very sick patients, who were in wheelchairs, who were not ambulatory, and, just on multiple meds. Now, the doctors by law also are supposed to see a patient within 24 hours of admission. That wasn't happening. So meds were not getting ordered that these patients had been on for, months and years, whether it be a kidney medicine, a blood pressure medicine. And then you'd have one nurse trying to do admissions and also being responsible for giving medications. So it was my responsibility to assign staffing. There are ratios that you have to do. There's different levels of acuity. Children, have a higher staff ratio. And you take a lot of different factors into account: their acuity, their behavior. And so I was responsible for determining how many nurses should be on a unit, how many mental health assistants should be on a unit. And I would come in the morning, and some of those would have been canceled. And then I would get a call. I literally got a call from the CFO every day telling me I had to cancel people. And I would say, but you have a 1-to-1, you have, a patient on a 1-to-1. That means that on a 1-to-1, one person has to be within arm's length distance from that patient because they're a danger to themselves and others. And then there was another term called constant, where one person has to have eyes at all times on patients, and you could have a constant with one staff could have a constant with 3. So sometimes the CFO would say, well, take this person off constant, take them off close observation, so we can cancel this staff member.
And another way to think of constant is a 1-to-1.
Yeah, a 1-to-1, but within yes, the close would be within arm's length. Constant, they'd have to be in a place where one person can have sight on them,
which would be impossible if one person was responsible for 20 and 3 of them were supposed to be constant.
right?
And an example, Jackie, of somebody who may be under constant or 1-to-1 observation is someone with a psychotic disorder like schizophrenia. And so it wasn't just mental health disorders that Acadia facilities were expected to treat and advertised and marketed that they could treat. It was also things like eating disorders, post-traumatic stress disorders, in addition to a panoply of mental health disorders, like Jamie was saying, bipolar, impulse control, disruptive behavior disorders, and, ultimately, suicidal patients who had suicidal ideations, and their family felt they would be safest being in an inpatient facility under observation. Unfortunately, they didn't appreciate that their loved one wasn't going to be under any kind of observation, and worse, being put into dangerous situations with other patients who had similar conditions.
Right. And so there were patients being admitted, and then once they were admitted, not receiving the treatment that they needed, but there were also patients being admitted that shouldn't have been admitted at all, right?
Well, even for behavior, you're supposed to assess whether this patient is too dangerous to be, say, around other kids. Some have, sexual issues and have done harm to other kids or people, animals, sexually, physically. They're a danger, and So what you should do is to say, okay, I have this is my acuity right now on this unit, and I have 2 people already who are big behavior issues. And you have to remember too that so these patients being admitted, they would be in a state of shock, and oftentimes people would become irate that they were locked into this facility. You'd have voluntary patients go in, and all of a sudden they're thrown in and nothing's explained to them. So people would go, as we say, off the chain, and codes would be called. So you would have to have not only enough people on the unit to take care of the patients, but also to respond to codes. Um, and, the codes would be the whole procedure on that. And Eva started to touch on that. The procedures, how to handle somebody who starts, beating themselves up or beating other people up and end up on the ground. And you have to have an RN, only an RN or a physician at the head of a patient like that. That's considered an emergency, the worst thing that could happen. And these kids would be, your people would be taken down by 1 or 2, assistant staff members, and not everybody wasn't coming, at a code, all the doctors in the building should come. But there weren't enough people to come in these codes.
And that's that's why this rose to corporate fraud. Jackie, right? It's not just a bunch of cases of malpractice by a bunch of inexperienced, providers. It was corporate fraud because Acadia knowingly and intentionally short staffed all of these super significant housing, super vulnerable facilities, super vulnerable facilities that were housing or super vulnerable patients housed in these facilities. They were short staffing and otherwise putting pressure. And Jamie talked about this a little bit ago about how she would get calls from the director or the regional manager for Acadia pressuring her to do admissions and otherwise ensure that their short staff ratios would be enough, would be sufficient, but to keep admitting patients and to also keep them in the facility for excessive periods of time. So Jamie would make observations and her staff would make observations like this isn't a good environment for this patient, right? Either because of what you said, Jackie, which is they weren't eligible for this kind of treatment in an inpatient facility to begin with, or it's actually just not helping them because they actually aren't treating these patients in the way that they need the treatment. And so, but Jamie would end up being forced, basically, or at least being told to keep the patient in the facility because it was corporate pressure to continue to bill for all of these government insured patients. And as Jamie said, we're talking not just Medicare, so elderly patients, not just elderly patients, but also Medicaid, which are the juveniles and the adolescents who, frankly, were made worse, frankly, from what Jamie was seeing by being housed in these facilities and not being able to leave.
Yeah, and sorry, I lost my train of thought. Hold on.
Well, but it's actually a great segue to this is one of those cases of corporate fraud where they took advantage of every step in the process.
Right.
From the time of admission, Jamie was saying within 24 hours, you're supposed to see a physician. Didn't happen. You're supposed to have an individualized treatment plan for the whole duration that you're in the facility. Never happened. You're supposed to get all the medication that you're otherwise entitled to, like insulin, kidney medication, whatever it is. Didn't happen. You're supposed to get medication to help treat the behavioral health issue. Didn't happen. You're supposed to have planning and treatment before you're discharged out into society and in the public. Didn't happen. And what did happen and what Jamie did observe were patient harm in the facility, elopement, preventable suicides, which is a terrible tragedy and probably one of the worst consequences of this, and patients who frankly just either nothing changed for them. So Medicare, Medicaid, and TRICARE were paying for services that were never provided, or they got worse. They got worse. And so Medicare taxpayer money was paying purportedly to help patients who ended up even worse than before they were admitted to the facility, to an Acadia facility.
Yeah, and I think one of the one of the easiest things to kind of measure when you're looking at the cases, like the length of stay of what they did with base Medicare patients versus private insurance
Right.
payer patients, right? So,
Absolutely.
Jamie, can you talk a little bit about the difference of length of stay between those two groups of patients?
So with a government patient, a Medicare or Medicaid patient, the way they get approval is the Medicaid and Medicare will cover the first 3 days automatically. You don't have to go back and request more days. Then it's 5, then it's 7, and um, and they're guaranteed payment. So this is a lot of times it's the bread and butter for physicians because it's guaranteed payment. They, you know, um, what do
Well,
I
they're
want to?
locked in, right,
Yeah,
Jamie? They're
right.
locked in. Once you
Right.
get past that 3 days, they're more or less locked in. Yeah, go ahead.
So there'd be conversations, during our rounding. What insurance does this patient have? And it would be determined, their discharge date or would be determined by what insurance they have and how difficult it was to justify the length of stay. And say a patient's on day 4, but Medicare has already approved 5 days. Um, they would keep that patient longer because they would get paid for it if they did. Um, and they, didn't have to justify until the 6th day. So, I mean, they would order labs that, um, were never done and repeating things. You don't need a CBC on a patient if they just came from the ER and there's a CBC done on the patient in the ER. Things like that, but it very much mattered what patients they have because somebody with a private insurance, they typically have to pay a percentage or they have a deductible. Well, what's the first thing in times of trouble? What's the first thing an individual would choose not to pay? It's mostly medical bills, and that's why they start hounding you after 1 or 2 days of being late. So to combat that in their eyes, they would keep the patient.
And Jamie, I remember you sharing with us, they were also very careful to discharge the patient as soon as payment was done.
Correct.
Right. So even if the patient still needed services or clearly wasn't well, they would discharge the patient because they weren't going to get it paid for a day more than whatever was approved by the Medicare, Medicaid, or TRICARE program. And so it had nothing to do with the patient's care for a government insured patient. It really was this, well, how much can we maximize payment out of this one person? And then at the time that we're not getting paid for them anymore, they're out. Versus commercial insured, to your point, Jackie, when you look at the data, which is exactly what part of the DOJ investigation involved, it was a lot of data analysis, both in terms of staffing patient ratios and then length of stay. You are going to see excessive lengths of stay for government insured patients versus commercial because commercial private insurers are better about limiting and otherwise checking like medical necessity of the service and auditing their records. Jamie had examples where when audits were happening at Acadia, they were very careful to paper the record, right, Jamie? And make
Like
sure there was.
not show the canceled staff. They would show what the staff was supposed to be, not
Right.
show the changes that were made an hour after they got there and they go home. Um, as far as discharge planning goes, they would discharge people because they didn't have the coverage yet. But say if they're, Medicaid, a poor person is homeless, um, you should keep that patient until you have a good discharge plan, because what do you think is going to happen for, a behavioral health person, a sick person who goes and they're exposed to all these stressors, like being homeless or not having access to their medications? You shouldn't discharge patients that have these high risks for being readmitted. So we would have uh, high readmission rates, um, and just really sad stories.
Yeah. It was almost like they were using these patients on a conveyor belt, right, Jamie? Like they
Right.
would discharge improperly, and then they would be only too happy to readmit them once the government insurers would kick in payment again. But they weren't really ever helping or treating these persons who really needed serious behavioral health oversight and treatment, right? I mean, that's what was heartbreaking for you.
And long terms say, well, we had one long-term schizophrenic who was um, probably 80, and he was a repeat patient. And when you admit a patient, you also have to have a reasonable belief that the patient is going to get better by being in the hospital. That, you know, g- adjusting their medications is going to help them get better. This gentleman was so sadly, far gone that he would keep getting readmitted, and this patient ended up in the refrigerator of the cafeteria. He was also a patient because of his, um, unstableness and lack of wherewithal. Should have been on a close a 1-to-1 situation. So he wasn't, obviously.
Because Acadia wouldn't pay for it.
Right. So he ended up in the walk-in refrigerator. And I think
Yeah,
that would leave
really,
you
really sad.
dead, you know, at some point in a local newspaper. But,
Yeah,
so I'm the type of person that in 5th grade, I went rolling houses at a little girl's party. And the mother the next morning said, "Did you see what happened across the street? Somebody got rolled." And I said, "Are we going to get in trouble?" So I, you know, I I started from the very beginning emailing and emailing and emailing. Here are the things that are happening, and I had a law degree. I'm not putting my license and my livelihood on the line um, and show that I condone these things.
uh,
I strongly believe that people who do not act when they see injustice are just as guilty. I really do believe that. And so, I would be talking back to the CFO who was calling from Nashville, telling me what the acuity was going to be. And, patients were getting harmed. So then, when I was ultimately fired, I was called in and told, "Well, we know you're not happy here, so we're firing you. We're laying
Yeah,
you off."
I'm so yeah, how did that come about exactly? So you've been complaining to both, I think, HR
In
and to the
writing,
CFO, the
HR,
CEO.
yes, in
Um,
writing, HR, on the phone. Um, I didn't care. I was going home with blood pressure issues and like devastation at dinner every night. Our kids and my husband would say, "What's happened today?" And I had no support. I had no CEO saying, "Yeah, this is wrong." I had nobody saying any of this was wrong. Um, and so I was called in one day, and I had just started saving some emails and saving some census reports and emailing myself. But I was called in just for a meeting and was told, "We're letting you go. We've taken your computer. Um, we'll escort you to go, get your personal belongings, but we know you're unhappy here." Um, I mean, that's all she said. I just thought, you know, um, it was so bizarre. And I'm, never been fired for anything. And so luckily I'm very well educated. I went to a very good school for high school here in Atlanta, and I knew who to call to get help, on that way
Well,
home.
yeah, and you lasted what, 9 months? That's better than the previous 6 directors, right? So,
Oh, and
I
I was
mean, you
offered
got
money.
that going for you.
So I was offered a lot of money to be quiet. Um, and I said, no thanks. I was offered a lot of money. Um, and, you know, I'm friends with the Attorney General of Georgia. I called a collar crime attorney that I went to high school with. Both I went to high school with. And, that day, the attorney that I talked to said, Jamie, this is the craziest thing I've ever heard. And he called um, Ava's firm, and I went to see them the next day. So it was
That's
great
great. So,
relief. And then,
yeah,
after that, to think of working, and I went to kind of a more laid back job, for sure.
yeah, let's Eva, talk about how you and your firm got involved, and also there's another companion case to this one. Can you talk about how, on the legal side, how you and your firm and your partner got involved, and also how the other case in kind of interacted with this one, and kind of how that legal side of that worked, how you guys worked with the government, all of that kind of stuff.
Yeah, absolutely. Happy to. I just want to say first, though, that Jamie did exactly what you hope everyone would do. Your neighbor, your teacher, your co-employee, your boss. When she saw something that wasn't right, and frankly, she knew was illegal. And just to be clear, Jamie wasn't acting in a legal capacity on behalf of Acadia. She just happened to have that background. She was their director of nursing. She immediately raised her hand. And when she realized she wasn't getting anywhere in the company, she found an attorney who understands fraud cases against government programs. And that was us. And so
And
we were so
fortunately,
grateful.
I knew if I didn't have a job, um, you know, it would be okay. A nurse can always get rehired, but I wasn't going to be destitute. I was married, and so there. I'm sure there are plenty of people who were wanted to say something, but not because they would lose their jobs. They were seeing people being fired, and most of them had signed a non-disclosure and taken hundreds of thousands of dollars to be quiet. And I was the first one that said I'm not doing it.
No, that's true. Although I will add, I mean, you can still stay in your job. And Jackie, many whistleblowers who remain employed, but they still whistleblow. And they're still lawfully protected with their whistleblowing activity. And so, yeah, you're spot on, Jamie. I think you were in a truly unique position where you weren't afraid of necessarily being terminated or being without a job. But there are whistleblowers who can stay employed and still
And
report on fraud.
you should
Ri-
employed. I mean,
Right.
it's retaliation to fire somebody.
Exactly.
Just again, they didn't care. They thought they could do, and probably still do, think they can do whatever they want and not have recourse.
Yeah.
Hmm.
Yeah. So to get back to your question, Jackie, yes, it was frankly really fortuitous that Janie came to our firm. We were so happy to hear from her because behavioral health issues are something that my amazing law partner Renee Brooker and I feel very strongly about. This is a really important service that government insurance programs pay for, and when fraudsters like Acadia take advantage of that service, that makes it less money for other people who actually need the service and need that service paid by the government. And so we were more than happy to help her develop this case. We had the awesome privilege of really working the case together with our really talented co-counsel, Janelle Quinn from the Employment Law Group, who had the other case, Jackie, that you have referenced. And she had two whistleblowers or relators under the False Claims Act who she represented in that case. And so really us at Tycko and Zavareei and Janelle at her firm became really the dream team of attorneys with our whistleblower clients, who were all fantastic for stepping up, coming forward and speaking up about this fraud. And we had the huge benefit, Jackie, I know you can relate to this, of having a really excellent government team. It did pass through several hands because this was a 7-year investigation. As we all know, these cases take a lot of persistence and patience and ultimately perseverance in really getting to the truth. Companies are not always willing, and Acadia was certainly a good example of this, willing to cooperate in the investigation, willing to produce documents that corroborate the fraud, willing to provide witnesses who would similarly testify to the fraud, and then ultimately willing to settle and resolve the case and pay back money that was defrauded from these government programs. But we got there. And we got there because we had this really extraordinary powerhouse team of relators attorneys with Renee, Janelle, myself, and whistleblowers, Jamie and Janelle's two clients, and government team. It's a trifecta, right? Ultimately, in these cases. And the government team was the Department of Justice civil fraud attorneys, together with the settling state attorney general's offices, who really also banded together and put together a very impressive story on liability under the False Claims Act for Acadia using their own documents. I mean, that's something that's sometimes missed in some of False Claims Act cases. I think it's always interesting when you see the defense bar or companies, looking to kind of diminish False Claims Act enforcement. We're using their own documents to prove the fraud, right? And their own witnesses and their own employees, whether current or former, their own vendors, their own patients. And so we're not creating something out of nothing or out of, some imaginary storyline and imaginary players. It's their own records. And it still took quite a bit of time and quite a bit of patience, but it's another example to Jackie of where typically for those who are well versed in False Claims Act litigation, sometimes you don't want too many parties or too many people in your party. There are certain procedural bars like first to file and other legal hurdles, also public disclosure. Here, we really made it a good example, I think, of setting aside those possible legal consequences and ramifications and realize there's a greater purpose here in us banding together. And I really give a lot of credit to Jamie and her fellow whistleblowers that Janelle represented for recognizing that and realizing if we bring our information together, because they were at different facilities. And I think there's a lot of value, especially as you see companies expanding nationwide to different regions, having witnesses or whistleblowers from different facilities, different regions coming together, because then it makes it much more obvious that it's corporate fraud. It's systemic pattern and practice of fraud across facilities. And so by coming together, we were able to, frankly, in my opinion, recover more money on behalf of these government programs and stop greater harm to patients versus if we had just filed a case specific to Jamie's Lakeview and Riverwoods facilities. Yeah, we would have stopped the conduct there, but it would be flourishing in other facilities and harming many other patients in other states. So I really give everyone a pat on the back in terms of staying with it, staying with the case.
And absolutely. And that's such a good point that you made at the end about the systemic kind of nature of this case and other cases like this, because these healthcare companies are getting so large, and especially with this, and in this case, Acadia had grown something like 600% or something right before this, this behavior started, right?
Yeah.
Because it was pretty clear that the corporation, the corporate people came in at the expense of the healthcare people and basically booted everyone out, understaffed the facilities, and in the name of making profit here. And that is why this case even happened, right? Is because
Yeah.
none of this is what this case is about,
We always
essentially.
say, in good times you have behavioral health patients, and in bad times you have behavioral health
Right,
patients. So
right.
Yeah. It's really maximizing profit over helping patients get the services they need. I mean, that's a common theme in all healthcare fraud. And it's disgusting when it's, taking advantage and preying on a very vulnerable population like Medicaid and Medicare patients who feel like they don't have anywhere else to turn.
And particularly here where these are behavioral health patients who really do have nowhere else to turn. So this is particularly egregious behavior that, Jamie, we do salute you for helping to end some of this behavior and not just returning money to the taxpayers, but really putting an end to some of this really bad behavior and making a bigger difference. I think that there's other investigations that are happening a little bit across the board. I don't know if you want to speak to that at all, but I think there's been in the news some discussions of other investigations that are out there as well.
yes, yes. I mean, I think criminally and civilly, there, I plan to testify in other ways, and to me, that's the ultimate win. That's where I feel like I I have made a difference in the world, is when policy can change and oversight. And it's really important to me that they had an overseer. Because sometimes they get ordered to have an overseer who's monitoring what they're doing. And I think I don't think that their troubles are stopping with this, and I'll do my part to hope for that.
Yeah. I
Absolutely.
mean, Jamie was actually interviewed, Jackie, by the New York Times because the New York Times had done some of their own investigative journalism of Acadia's facilities and practices, independent of the DOJ investigation. And, lo and behold, found the same fraudulent practices in those other locations. And so when the settlement was announced, they reached out to Jamie and profiled the settlement and otherwise kind of raise the issue of our bigger investigations and more investigations into Acadia's misconduct. And so you probably will hear more from Jamie, which will be fantastic, and from others who witnessed and or experienced the same kind of really fraudulent, egregious behavior at the hands of a company like Acadia. And so, yeah, I mean, at the end of the day, if deterrence is the ultimate, goal or the ultimate consequence, we've succeeded, right? Because it's really trying to deter this conduct from happening again. And you make an excellent point, Jackie. It's less about like how much the settlement is and more about does it actually stop the fraud that's happening at the expense of patients in
We're
person.
we're all suffering, now you just hear about the violence going on in the world and in our children's schools, most specifically. Just it's it's just so important that we strive for improvement in the behavioral health realm, because there are people out there that need help. And you know some of these patients will never want to go and say, these things happen to them. Are they ever going to reach out and seek help again? Are they ever going to get the help if they do reach out? And it's the evil. There are lots of quotes, about how the evil of one thing can be lead to the evil of everything. And I just think it's just very scary what we've all had to see on the news, every day. You never know when you're going to hear of another tragedy.
Well, it'll continue until they're held accountable. And that's the huge benefit of the False Claims Act, is that it holds these companies accountable to not just the government, but to the persons that they are supposed to be serving and their employees.
And to be
Because
going to law school, I I didn't really know anything about the False Claims Act. I was just so fortunate to have called, someone who did know and who me reach out to the right people because it's we need to get the word out about whistleblowing and of course, you grow up tattletaling. They never win. It's not a good thing. But we do need to really encourage people to stand up and make and when they do see wrongdoing, because all of us as a society are going to reap the benefits of that. Of
yeah,
just
it's a great point, Jamie. And by the way, I didn't know anything about the False Claims Act in law school either. This is something Jackie needs to start teaching a class at the Washington, D.C. law schools about the False Claims Act, because more people need to know about it. And you're right, Jamie, there is a negative connotation when it comes to whistleblower, because it is often thought of as a tattletale. And it's why people are reluctant to do it. And it's important for them to see that there are enormous positive consequences from speaking up. It's not tattletaling. It's literally just speaking up on behalf of others that wouldn't otherwise, be heard. And
we're
so
the
I
most
applaud.
vulnerable population, the most vulnerable of people were being affected.
I mean, really, this is one of those rare, I shouldn't say rare, but this is one of the instances where a DOJ investigation and resolution prompted a bunch of other investigations. It's really what you would expect to happen, right? Because Jamie, you've now gotten contacted by a bunch of people. Reporters are getting in on it. Like, this is the kind of sustaining effect that you would hope would happen after you file a case like this.
Yeah, I mean, that is what you want to, see happen, though, right? Like, you want to
Right.
see not just your resolution to your False Claims Act case, you want to see shareholder suits, you want to see criminal investigations, you want to see Senate investigations, you want to see this have a big impact, and that's what's happening here.
Right.
I think it's really important. It really speaks to the importance of what we're doing, what you're doing, Jamie, and important work that all of the whistleblowers are doing.
I mean, even Renee, it's shocking to realize how much work they put into it. It's not an easy road at all, to get through this. I mean, it's really a testament to their intelligence and and their connections, and their willingness to work for nothing for so long.
Thanks,
Yeah,
Jen. Yeah.
Yes, the whistleblower lawyers doing this work are doing incredible work as well, and it is a long haul to get these cases across the finish line. So, thank you to.
It was a female powerhouse team. I'll
Yeah,
just throw that
I
out
love
there.
that.
It was.
the
Mhm.
tenacity of women trying to make a difference. And
That's right, Jamie.
Well done to all of you, and thank you so much. Jamie, I do have just one last question for you. Um, you know, as we've been just discussing, though, I feel like what you've done has made a big difference, regardless of how huge or not huge or whatever the actual money brought back in from your settlement is, or, whatever. But having kind of been through the process, long process, but you've been through the process now, would you do it again?
Oh, absolutely. Absolutely. I mean, there was no, after leaving that place, there's been no harm to me. And, other than just the stress of it and getting over that. And absolutely, I would.
Well, good for you. We thank you so much for all that you've done, and all that all of the whistleblowers have done and will do. And any last takeaways from anyone?
Just, you know, speak up. Really, that's the biggest, speak up and go to experienced professionals, like Jamie did, to know how to deal with a situation when you're faced with someone doing, bad acts, or worst case, acting, unlawfully. Because our bar is, speaking on behalf, Jackie, of TAF, just generally, is really experienced in this space for decades. For decades. I mean, unfortunately, fraud has been going on for till the beginning of time. We just have gotten better and more sophisticated, and more savvy in terms of how to figure out what is credible fraud and what is not. And when it is credible, pairing up and working in tandem with government agencies like the DOJ and the state AG's offices really proves invaluable. So I just kudos to everyone on this team, including my partner Renee and our co-counsel Janelle, and the relators who were so brave and really just right, in realizing this was something that had to be corrected, and exposed. So I give you guys all tons of credit.
You have to stand up for those who cannot defend themselves, who cannot, I mean, the harm that's been done, it just makes me sad.
Thank you again for all that you've done. Thank you for joining us today on Fraud in America. Thank you to Get It Law for being our sponsor for this podcast. And please join us again for our next episode coming up soon. Thanks again, Jamie and Eva.
Thanks so much, Jackie and James, and thank you to TAF. We appreciate the opportunity.
Our 2024 sponsor is Get It Law, a boutique Manhattan law firm dedicated to fighting fraud and promoting business integrity. Learn more about the firm at www.getniklaw.com. If you believe you've witnessed fraud against the government or on the financial markets, or want to learn more about the laws that exist to fight fraud, visit taf.org, where you can find a directory of whistleblower attorneys who work across the country. On our website, you can find information about the nation's whistleblower laws and programs, and a way to donate to our organization as we continue to fight attacks on whistleblowers and these laws. Fraud in America is presented by the Anti-Fraud Coalition. Jacqueline DeMar is our host. James King is our executive producer. The website for Fraud in America was designed by Wide Eye Creative. Our artwork is by PPA Agency. And our theme song is by Spatial Relations.